Hi, I'm Dr. Jim Hoven of Ramos Law and your host for Health Matters. Have you experienced pain? If you have, it's important to know that there's different types of pain that you could be going through, and there's a different way to treat them. There's acute pain, subacute, and chronic pain. Join us, we're going to talk about it next. If you've gone through an injury of any sort, whether it be a car accident, a sports injury, even some sort of postural injury that has taken place over time, you may be experiencing pain. It's important that we categorize your pain. In other words, give it a typing so that you can get the proper treatment and know how you can move forward in a meaningful way so that you can get out of the pain and back into your life. Now, under pain, there's typically three kinds of pain that we talk about. There's acute pain, there's subacute, and chronic. And those are basically determined by the amount of time that the injury has been present or the time that you've had the pain. For acute pain, we see that under just between immediately after an injury and within 72 hours. Some people will push it out even as far as a week. If you're experiencing pain in that time frame, that's what we call acute pain. It's often accompanied by things like bruising and swelling. It's typically a sharp pain. It's not as dull, and it will also kind of flare up on you. So that's the acute type of pain. Now, if the pain has been present for longer than a week and moving up to about 4 weeks, that's going to be subacute. Now, subacute means that you're moving from that just first real swollen and bruised stage to where now the pain is becoming more of a, it might go back and forth between dull and achiness and sharpness. There could be stabbing in there. So subacute is a transitionary phase that is on its way to chronic pain. So if you've noticed that your symptoms have been there for over about 28 to 30 days, that's generally where we start considering things chronic. Now, chronic pain often is categorized as being more dull in nature or deep. It can be aching and gnawing, but it's not usually that sharp pain unless you do some kind of activity that would aggravate the acute component of a chronic injury or chronic pain state. So let me break it down like this. New injuries, more acute, we treat them different than chronic pain that's more long-term. In the case of a traumatic injury, if you have an acute injury, we might use things like ice, we might use things like non-steroidal anti-inflammatory medications, we could use different taping procedures to pull swelling. All of that is how we're going to deal with the acute pain. Along with, we want you to get some movement as providers. So when you're seeing your doctor after one of these types of acute injuries, we want you to put range of motion in, but it should be more restricted so that the range of motion isn't full, causing more pain, but rather very, very slight. If I were taking my head, just moving it back and forth in the neck range of motion, I don't want it to cause that any more pain. It's just to kind of act as a pump to get fluid in there. So that's when it's the acute stage. In the subacute stage, we're still doing things that we might manage acute pain with, like we might be putting still some ice on it, especially after activity. And we also are continuing to do some of the motion work, moving our neck or whatever joint that it might be. But now we're also going to be looking at beginning to put some little deeper pressure on things to get some soft tissue work done. That's when we might introduce massage or something like that, so that your doctor might recommend that you get some physical medicine. That will typically go on in the subacute and on into the chronic. When we go into chronic pain, that's where we're going to be using a lot of heat to drive more blood flow to the area. But since there's not a lot of typically swelling at that time in chronic pain, then it's okay to use the heat because we're not bringing in a lot more fluid. We're bringing in healing blood. Now, for some people, because again, they're still doing their daily activities that are flaring up chronic pain, that's where we're going to use heat and ice back and forth. Now, of course, check with your provider before you do these kinds of things, but overall, these are very, very, very safe instruments, okay, that you can use for your healing. Now, the last thing with any kind of pain, whether it's acute, subacute, or chronic, is the things that you can do to help with the pain generators. Number one, make sure that you stay away from activities that aggravate the pain. That's obvious and makes sense. Number two, drink lots of water. The water will help flush your system and decrease some of the pain-generating signals. The third thing we've already talked about, use ice and or heat appropriately. And fourth, make sure you're taking anti-inflammatory foods in, so stay away from sugars, grains, that kind of things that are real pro-inflammatory. We've talked about that before. And increase the amount of fish oils that you're taking. That's a great anti-inflammatory. Making sure that you're just really eating clean, staying away from sugars, that's a great, great way as well. You can take a lot of natural anti-inflammatories that you can get at any health food store. that have bromelain, papain, trypsin, chymotrypsin. There's a whole host of things. But again, check these out with your providers. Just, I'm not trying to give you medical advice here, but rather give you direction. So if you have acute, subacute, or chronic pain, there are certainly ways that you can take care of that. Oh, by the way, one more thing. For the subacute and chronic pain, always look to use foam rolls, lacrosse balls, all that kind of thing for self-massage. Works great, but you got to know how to do it. So again, check these things out, do your due diligence before. And in the meantime, if you have any questions on this, on acute, chronic, subacute pain, please reach out to me. It's jim@ramoslaw.com, and I'll be happy to answer those as best I can. Until next time, remember, your health matters.